First off, thank you for joining us. Can I just have you start? Why do you want to run for this seat?
That's a really good question. After Representative Doug Mann asked me to run for the seat, I had to really kind of take a good hard look, living in a public life, right? And being a nurse, I'm a trained advocate, professional rapport builder, and looking around and being down in the Capitol, I saw that we have a lot of the skills, being nurses, we have a lot of the skills to be able to be a good legislator, to make those relationships. And as an advocate for MU Healthcare and their patient education and professional development, basically all I'm doing is expanding my circle of advocacy.
You mentioned being a nurse, and I saw on your campaign website too that would make you the only nurse to be in one of those seats. I guess, can you kind of expand on what traits you think translate over from being a nurse that would be beneficial for running for this seat?
Yeah, absolutely. Well, people see me sometimes on the worst day of their life, right? And nurses, we have to take care of the patient in front of us. We're advocates. Again, being a med-surg nurse, you kind of start off with one patient, and then being in charge nurse, you're advocating for a whole floor. And then being in leadership, I'm advocating for a whole system, right? Also, nurses are professional rapport builders. People come to me, we take their clothes, we give them a funny gown, we stick needles in their arms. At all times of the day and night, you have to build rapport with people almost immediately. And those are skills that actually serve legislators really well. Listening to people, making sure that you never forget that there's another person on the other side of every encounter.
What would you say the biggest issue facing the 50th district is that you would like? What would be your top priority?
Sure. There's a lot. It's split right now probably between healthcare, access to healthcare, and public education. With respect to healthcare, obviously there's an almost total abortion ban here in Missouri. Women are really scared that they go to see if they have a pregnancy, and they go to see their physician, that their physician not only has to call an insurance company, but then also has to call a lawyer too. That's a really difficult thing for women, often in their most trying time. The other thing is public education. We've seen kind of a persistent, reckless attack on public schools, particularly targeting Columbia public schools. And there's a lot of fear with respect to teachers leaving the profession. Like we're a farm league for both St. Louis and Kansas City. And also Columbia has so much to offer. And we have a great Rockbridge High School right here in the 50th as well.
Going off education, I know there's been a big push for charter schools, which is something that a lot of people from Columbia Public Schools have come out against. Where do you think the state of Missouri education is, and what would, what's your stance on charter schools and anything you would like to see done differently in the educational
Sure.
space?
Yeah, well, charter schools, anytime you're going to be taking public dollars and putting them into a private enterprise, you're going to have a lot of oversight. And personally, I don't like charter schools, particularly with an accredited district like we have. Most of the educators that I've talked to, and virtually everybody on the doors that I've met is not in favor of charter schools. Our teachers actually need support. They need investment so that they can in turn support our children when they're teaching. So in terms of, that's how the 50th is. In terms of the state, education kind of is in a real rough strait. There's an unfunded mandate that just got passed and signed into law by the governor in May. It remains to be seen kind of how that plays out over the next year and a half. It's really challenging. There's going to be some difficult decisions needing to be made at all levels of government.
So seeing that you believe the public schools could use a little bit more support, and I know you brought education up as one of the top issues that you think the district is facing, would you say that's where your biggest spending priority would lie? Or spending-wise, what do you think, if you were in that seat, where would your priority be there?
Sure. Well, the budget process is a really complicated process, right? And Democrats are in the super minority, and we're not setting the agenda at all. We actually have to build coalitions to see that anything gets done. So obviously healthcare is going to be a huge priority. I mean, look, MilHealthNet, they haven't been able to process all of the Medicaid paperwork, right? Why is that? Is there not enough investment there? We have some of the lowest paid state employees in the country. So that's one part. The other part in terms of education is there's going to need to be, again, like I said, some really difficult choices. There's these rural districts that are going to be getting a little pay bump, but we don't know where that money is going to come from yet. Is it going to come from the university? Is it going to come from somewhere else? Is there going to be a tax increase? We have no idea.
With as far as healthcare goes, another interesting thing I was reading on your campaign website is you think a lot of lawmakers in Jefferson City are kind of having a negative effect on healthcare. I guess can you kind of elaborate on that and what you would like to see done in that space?
Sure. Well, there needs to be an investment in the next generation of healthcare providers. Missouri Nurses Association was part of a consortium of interests that actually beat back 3 anti-DEI bills in the last session. These would have put our nursing school accreditation and our medical school accreditation at risk. These are significant things that are going to come back, and we're going to have to build that coalition to make sure those kinds of terrible things don't come back. Plus, of course, the almost total abortion ban that's been going on. We've had rural hospitals that have closed. We've had rural clinics that have shut. We have physicians fleeing the state because they're not being supported. These are the kinds of things that it takes somebody who's actually walked the walk to go down there and tell the stories, people, and try to, again, gain support, build that coalition to try to reverse that trend.
You did mention that abortion ban with Roe v. Wade being overturned. I guess how would you like to see Missouri handling that? What do you think is the proper way to go about that to make sure everyone's getting the best access to healthcare if they do have to make a difficult decision like that?
Right. My exam room was sacred space, and it's between a patient and her provider. We don't need extremist politicians in the exam room dictating what kind of care a woman decides for herself and for her family. So that is a total reversal of the ban and trusting healthcare professionals, trusting women. That's why I've had the endorsement of AAM and the National Organization of Women.
Kind of shifting gears a little bit, crime's been a hot topic. What would you like to see done to either address public safety concerns or fund public safety concerns? I guess where do you stand kind of on crime, or do you think it's an issue that's a bit overblown?
Well, it doesn't feel like it's overblown, and I can show you statistics showing that crime is actually down. Right, but that doesn't change the way that people feel about crime. People are more afraid. I think a lot of that has to do with the coarseness of the political discourse. And so what can we do about crime is get to know who your neighbors are. Because if they know who you are, they know who you're not, and then we're all looking out for each other. That which can befall my neighbor can befall me, and if we're all looking out and being together on that, it's better for everyone. There's also a fentanyl crisis, an opioid epidemic. This is a public health issue. The criminal justice aspect of that is in the trafficking and the violence associated with that, but this is a public health issue that actually needs real investment. My predecessor, Representative Mann, actually had a bill that I testified about, making sure that there's more access to Narcan. And also, in terms of other public safety, I think roads and bridges, well-lit streets as parts of public safety. These are things that we actually need investment in, and these are things that there's the money for. There's just not been the political will for from the extremists down in Jeff City.
With fentanyl, I know a lot of people on the other side of the aisle will blame that on illegal immigration. I know Governor Parson's been big on sending resources down to the border because it is an issue that does affect non-border states. I guess what are your thoughts on immigration, and do you believe it's a direct correlation with a lot of the fentanyl that's what we've seen in mid-Missouri?
Yeah, I haven't seen kind of that direct correlation. The reality is that the current administration in Washington, D.C. has had more interdictions than the one previous. That's actually a good thing. We need to make sure that we are stopping bad actors from getting across the border, and we need to actually take the extra resources and invest it here in our community. Missourians are dying. In terms of from opioid. I talked to one person who told me that his son was murdered by fentanyl, and I'd never heard that kind of term before, but it really struck a chord with me that he felt so strongly. And he had gone to different providers, he'd gone through different clinics and gone through rehab, and as we know, it's a long road to recovery, but we have to invest in people to make sure they actually get to recovery and become a taxpayer, and it takes investment, it takes political will.
Homelessness is another thing that we've seen kind of talked about, not only just in mid-Missouri, just across the country, specifically here in mid-Missouri. I guess what do you think the best solution is to handle some of the homeless issues that have popped up?
Yeah, well, there's two different kinds of homelessness, right? There's chronic homelessness and acute homelessness, and they both have very different solutions. Acute homelessness is somebody who maybe wasn't able to make their rent that month or had a medical bill that kind of put them out on the street for a little bit. They require a different kind of intervention. Chronic homelessness, particularly among our veterans, takes a different kind of intervention. We actually have to find them services, get them into programs and things. I'm so glad that we have the VA here, make sure that they have access to substance abuse if that's required, or mental illness. What we don't want to do is like treat them as if they are outcasts in our society. These are our neighbors, and that which, like I said before, which can befall my neighbor can befall me, and I want to make sure that they are cared for in an appropriate way. But we've got to actually fund those resources, get them out to the individuals, and then help them get on the road to, again, becoming a taxpaying citizen.
With the recent events at the Trump rally, gun control is another thing that's kind of popped up once again. Missouri has some of the loosest gun laws in the country. Do you feel like those should be tightened up a bit, or I guess what are your stances on the Second Amendment and what that right to bear arms looks like to you?
Well, the Second Amendment talks about a well-regulated militia, first off, and the right for the people to keep and bear arms shall not be infringed. Right? We do have really, really lax gun laws here. I am a gun sense candidate. I believe that we do need to have more regulations, make sure that we get illegal guns off the street, and we make sure that individuals who have firearms are storing them properly. Right now, there's prohibitions on physicians even, asking and talking about this. This is a public safety issue. The American Nurses Association has been advocating for this for 20 years to try to make sure that we start saving people's lives. Children are being killed with firearms in the home, oftentimes accidentally. Sometimes they are, just victims of a targeted shooting that happens outside the home, right? We are awash with guns, and at the same time, we don't have access for mental health providers. I live with someone who actually had their life saved by some of these red flag laws, where people that have been diagnosed with mental illness or that sort of thing don't have access to firearms because of the volatility of who that person is, and so this is something that I take really personally. I've seen what guns can do to a human body, and I want to prevent that at all costs.
So kind of building off of that, say there was red tape aside that you had to cut through, what would in your mind, what did an ideal gun legislation look like? What would you have to do to purchase a gun?
Sure. I mean, obviously a background check, at all levels, and then making sure that there might be a need for insurance as well. I mean, I have a vehicle that I have to have insured. I think that's something that's definitely on the table. Making sure that there's adequate training, that we are storing firearms safely. These are all things that actually can be done that the extremists done in Jeff City. They won't even take up the argument about this, and I think that that's wrong.
Finally, I'll leave the floor open to you. Is there anything you would like to add that you feel like would be important for people to know, or any issues that might be important to you that we might not have touched on?
Sure. I mean, you've hit on all the things for the most part. The reality is this campaign has been, a lot of fun going out and meeting voters. I've personally run more than 2,000 doorbells, contacted more than 2,000 voters, about 1,500 doorbell, and I've had more than 600 unique conversations on people's front steps. People are interested in sending a healthcare professional down to Jeff City. We have a great carpenter, we have a great civil rights attorney, and Representative Smith, and we have a great educator. Ben, I'd be the first ever healthcare professional out of Boone County in at least the last 30 years, and it's going to take a variety of voices to make sure that we keep checking all the boxes and making sure that we move Missouri into the future and supporting the good voters of the 50th.
Well, thank you so much again for joining us, and best of luck to you, Bill.
Appreciate it. Thanks.